Dear colleagues, welcome to the Oncology Here and Now podcast by OncoAlert. Today we have the great honor to host Dr. Ahmadine Jemal, who is a distinguished cancer epidemiologist and senior vice president of the Surveillance and Health Equity Science Department at the American Cancer Society. Renowned for his leadership in building a multidisciplinary research team, Dr. Jemal's work centers on cancer surveillance, health services, and addressing disparities in cancer outcomes through the lens of social determinants and public health policy. Dr. Jemal, welcome to the podcast. And without further ado, let's just dive into it. Your team has just published the annual report of the nation in ACS cancer. And we have 3 questions on the actual report that we would love to ask you. The first one is, how did the COVID-19 pandemic specifically disrupt cancer surveillance and diagnosis in the United States? And what indicators did your team use to assess its impact across states?
Thank you, Gil, for the question. The pandemic disrupted receipt of routine preventive services, including cancer screening, which affected cancer diagnosis. So we used several indicators to assess the impact of the pandemic on cancer diagnosis, both at the national and state levels. First, we examined changes in the total case counters and incidence rates for all cancers combined, for cancer that can be detected early before recognition of symptoms through screening, such as breast colorectal cancer, through imaging for other conditions like thyroid and many other cancer types, and those cancers that can be detected early or also through clinical scrutинization, such as melanoma oral cavity. And we also examine changes for cancer that are often diagnosed after recognition of symptoms, such as pancreatic cancer. Second measure that we use is for these cancers, we also evaluated changes in the proportion of cases that were diagnosed at late stage of the disease, and also changes in screening prevalence.
Thank you very much, Dr. Jemal. Second question is, the report notes that the cancer mortality has continued to decline over the past 2 decades. What key factors do you attribute to the sustained reduction, and how resilient were these trends during the pandemic?
Cancer mortality rate has continued to decline since it peaked in 1991 because of reduction in tobacco use and improved early detection and treatment. The reasons that pandemic really didn't impact the mortality trend, because one, really for the pandemic to have any effect on mortality trend, it takes time. So we have only 2 years of data since the pandemic, 2020 and 2021 in this report. And that requires really any cases that were missed during the pandemic take time to be diagnosed at its later stages and impact survival. So we'll be monitoring the long-term impact of the COVID on cancer mortality as more data becomes available in future years.
So our third question is, despite the absurd dip in the incidence in 2020, rates returned to the pre-pandemic levels by 2021. What does this suggest about the adaptability of the healthcare system and public engagement with cancer screening post-pandemic?
So first, I think there are a couple of reasons. For the decline in screening and incidence rate during 2022 occurred for a brief or short period from March, April, and May, only 3 months, and the decline in incidence, which is reflected the decline in screening, was the steepest in May. Screening actually decreased by as much as 40 to 50% for colorectal and breast cancer. And as we also see from our paper, the steep decline in incidence rates occurred in April, and the rates become rebounded to the pre-pandemic level, but it didn't exceed the pre-pandemic level to compensate for the decline in the incidence rate during the 3 months, which I stated in March, April, and May. And there has also been a return to screening campaign by private and government public health agencies, including the American Cancer Society, and based actually on recent surveys, screening for colorectal and breast cancer has already exceeded the pre-pandemic level, showing the resilience of the health systems and the campaign that we have been doing to increase screening rates.
Thank you very much. And would you have any final or take-home messages that you would like to give our colleagues?
The good news is that, as I said, cancer mortality rates continue to decline in the US for all major racial and ethnic groups, and for both male and females. But there are also cancers that mortality are increasing for some cancers, such as liver cancer in female, pancreatic cancer in men, and endometrial cancer in women, and also oral cavity cancer in both. But more than that, actually what's is happening is incidence rates are increasing for many cancers that are related to obesity. In addition to what I said, the cancer sites that I said, rates are also increasing breast cancer, and for kidney cancer, for myeloma in both men and women. So we really need to focus on reversing the obesity epidemic, because obesity, we know that accounts for about 7 to 8% of cancer cases in the US, and almost 70% of adults in the US are either overweight or obese, and 40% are obese. So we have to work on that. Another area is smoking-related cancers are declining, including lung cancer. There are still 23 million adults who are current smokers now, and we have really strengthened tobacco control policy at both federal and state level. The third point that I would like to make is, which we have slightly addressed in this paper, but not fully, is the increase in young onset colorectal cancer. In our previous studies, we showed that incidence rates are increasing in young adults for 17 of the 34 cancer sites that we examined. And we don't know the reason for the increase in incidence rates, specifically in millennials, but the suspected risk factors, as I mentioned earlier, is obesity. There might also be some changes in microbiome because of change in the dietary pattern and antibiotics. But we have to do what we know in cancer prevention and control to all population, but also to understand the reason why incidence rates are increasing in this younger population.
An honor to have you here, Dr. Jemal, and thank you for your great insight into the Just Out report of the nation. Encouraging all of our colleagues to read the report out now on our partner journal, Cancer, from the American Cancer Society. Until next time, this is Oncology Here and Now. I'm Gil Morgan.